The following segment is sponsored by Renown.
About 78 million Americans have the most common form of vascular disease, high blood pressure, and luckily there are steps you can take to reduce your risk of vascular diseases. Here to tell us more about this is Dr. Michael Bloch, a vascular medicine specialist at Renown. Dr. Bloch, what are vascular diseases?
So vascular disease, quite simply, is any disease in the blood vessels of the body, the arteries that take blood away from the heart and the veins that return blood back to the heart. You talked about high blood pressure. High blood pressure is a risk factor for diseases in the arteries that can lead to blockages, that can cause stroke or can cause heart attack. So recognizing that you have those risk factors, getting them treated to avoid those heart attacks and strokes is incredibly important and something we really pride ourselves on here at Renown.
And so what causes vascular disease and who's really most at risk for this?
So the big risk factors for vascular disease, particularly arterial disease, are smoking, high blood pressure, high cholesterol, diabetes, and being overweight and sedentary. Some of those are obviously environmental, have to do with behavioral health aspects, but many of them are also genetic. We call high blood pressure, high cholesterol, and high sugars really silent killers because you don't know if those are elevated unless you have them checked. So it's important that everybody know their numbers. And if those numbers are abnormal, we can put together a plan to get those numbers back under control and prevent heart attack and stroke.
And other than knowing your numbers, how can vascular diseases be prevented, really? What are some good tips to keep in mind?
So it all starts with lifestyle changes. So we really, when we set down and individualize a plan with a patient, that's really the cornerstone of our therapy, really starting with improving diet, improving exercise habits, getting patients to quit smoking or use tobacco products, and then medications as needed. We'll use blood pressure medications, cholesterol medications if they're indicated, but in many patients we can control those risk factors with lifestyle modification alone.
All right, some great information. Thanks so much, Dr. Bloch. For more information, you can visit renown.org/wellbeingwednesday. Thanks so much.
It's my pleasure.